Welcome to the Deep Dive, the show where we really try to cut through all the noise and pull out the most important bits of knowledge from a whole stack of sources, just for you.
That's the plan.
And today, we're plunging into a topic that, well, it sparks a lot of fascination, doesn't it? This very human desire to boost our brain power.
Absolutely. It's everywhere.
You think about it, students cramming for exams, professionals trying to get that edge.
Or just anyone curious about optimizing their mind.
Exactly. And this whole pursuit has led to this growing interest in what people often call smart drugs, or maybe more broadly, nootropics.
And that's exactly the landscape we're going to explore today. Our focus is on a specific, often discussed class of these compounds, the racetams.
Racetams, right.
And within that family, we're really zeroing in on three that pop up a lot in conversations about cognition and memory: Piracetam, Aniracetam, and Oxiracetam.
Okay, those three heavy hitters. So what's our mission with this deep dive then?
Well, we want to try and get past the online buzz, the anecdotes, the hype.
Yeah, there's a lot of that.
And really unpack what the clinical trials and the solid scientific research actually tell us about them.
So digging into their effects on memory, cognition, figuring out who really might benefit.
Exactly. And looking at the downsides too, the side effects, plus practical stuff like dosage, maybe taking them with other things, co-supplementation.
Got it. And where are we pulling this information from? What's in the stack today?
It's pretty diverse. We've gone right to the source, rigorous scientific studies from journals like PLOS1, PubMed Central.
The primary research. Good.
Yep. But also comprehensive medical reviews from places like Healthline and WebMD, trying to get a balanced view.
Okay.
And we've even looked into their really complex legal status around the world. That's a whole thing in itself.
Ah, yeah, the legal side. It's crucial to mention right up front that the regulatory landscape for these, well, it's anything but simple, isn't it?
Not at all. It's a key part of the discussion, definitely impacts access and safety.
Okay, so let's dive in. Racetams. All right, let's unpack this then, starting right at the beginning. What exactly are racetams? Chemically speaking, what defines them? And, how do they supposedly interact with our brains?
Okay, so at their core, racetams are a class of chemical drugs, really, defined by a shared molecular structure. Think of it like a family resemblance.
A specific chemical backbone.
Exactly. It's called a pyrrolidone nucleases. That's the central piece. And many of them, like piracetam itself, have an even more specific version called a 2-oxo-1 pyrrolidinoacetamide nucleases.
Okay, that's technical, but basically a shared structural fingerprint.
Pretty much. It's what makes them a racetam.
And where do they come from chemically? Are they related to anything already in our brains?
That's where it gets really interesting. Chemically, they're derived as cyclic or ring-shaped forms of gamma-aminobutyric acid.
GABA, the main calming inhibitory neurotransmitter.
The very one. But here's the twist. They also look structurally similar to pyroglutamic acid.
Which is related to?
Glutamic acid, or glutamate, the brain's main excitatory neurotransmitter. The accelerator, if GABA is the brake.
Huh. So they look a bit like both the brake and the accelerator.
Sort of, yeah. And that dual structural resemblance, it gives us early clues that they might have these complex, maybe even opposing effects on brain chemistry. Modulating things, perhaps.
That's fascinating.
Yeah.
So it hints they're not just simple on-off switches. Now we're focusing on Piracetam, Aniracetam, and Oxiracetam. Are there other well-known members of this family?
Oh, yeah. It's a bigger family. You hear about Piracetam, phenylpiracetam, often talked about for their nootropic effects, too.
Right.
But, and this is important, not all racetams are nootropics. Some are used for totally different things, like Levetiracetam. That's an anticonvulsant used for epilepsy.
Okay. So just having the racetam name doesn't automatically mean it's for boosting brain power.
Definitely not. Same chemical family, but different applications.
Good distinction. Okay. Now the big question for many people. How are they actually supposed to work? What are the proposed mechanisms?
Well, this is where things get murky. Honestly, despite decades of research, since piracetam was discovered back in the 60s, there's still no single, universally accepted, fully nailed down explanation for how racetams actually work.
Seriously, after all this time?
Seriously, which kind of makes you pause, right? If we don't fully get the how sure can we be about the what?
that's a really important point, a big caveat. So if there's no clear mechanism, do they even bind to specific receptors in the brain like many drugs do?
That's another intriguing part. Generally, they show really negligible, almost no affinity for the common receptors in the central nervous system.
So they're not just plugging into known slots.
It doesn't seem like it. They don't work like many traditional drugs that target specific receptors. The leading idea, the hypothesis, is that they act more subtly.
How so?
They're thought to modulate existing neurotransmitter systems, kind of like fine-tuning the signals already there.
Okay, modulating. Which systems are we talking about?
Primarily, the focus is on the cholinergic system that's heavily involved in memory and learning, uses acetylcholine, and also the glutamatergic system, the glutamate one, crucial for brain excitation and synaptic plasticity, how the brain adapts and learns.
So tuning the memory system and the learning adaptation system, how does that tuning work at a cellular level? For piracetam and aniracetam, for instance.
Right. Let's take the AMPA receptor as an example. It's a type of glutamate receptor. Piracetam and aniracetam seem to act as positive allosteric modulators of this receptor.
Positive allosteric. What now?
Yeah, it's a mouthful. Basically, think of the AMPA receptor like a gate that glutamate opens to let signals through. These racetams don't open the gate themselves.
Okay.
Instead, they kind of make the gate easier for glutamate to open or keep it open slightly longer. They enhance glutamate's natural effect.
So they boost the existing signal.
Exactly. They make the receptor more responsive to glutamate. This leads to more calcium ions flowing into the neuron.
Which is an excitatory signal.
Right. And that increased excitation is thought to be part of how they might enhance memory or learning processes. Enhancement, particularly, seems good at enhancing both glutamate and acetylcholine signaling in key areas like the hippocampus and cortex.
The memory and thinking centers.
Precisely. And piracetam might also influence ion channels directly, increasing neuron excitability that way, too. So it's less about flicking a switch, more about adjusting the sensitivity or efficiency of the existing communication systems.
Fine-tuning, not forcing. That makes a lot more sense than a simple smart drug idea. Okay, with that background, let's get into the evidence. What do the studies actually say about whether these things work for improving cognition and memory? Let's start with piracetam.
Okay, piracetam. When we look specifically at its effect on impaired cognition, the clinical evidence is actually quite interesting, especially in certain groups.
Like who?
Primarily older adults experiencing cognitive issues. There was a big meta-analysis pooling data from 19 double-blind trials.
That's a solid approach.
Yeah. And it showed a significant clinical improvement linked to piracetam in older adults who already had cognitive impairment.
Okay.
A 2005 review also found benefits in older folks with cognitive decline. And some studies suggest it can help reverse certain types of amnesia and offer advantages in mild to moderate dementia.
So, for people whose cognition is already declining or impaired, there seems to be some signal there.
Yes, that's where the stronger evidence lies.
But here's the million-dollar question, right? What about healthy adults, people without impairment? Does piracetam boost their memory or thinking? Because that's the common perception, the smart drug idea.
And this is where things get really interesting and where the hype often outpaces the science. Despite its popularity for, exam prep or boosting focus, the evidence for piracetam enhancing memory in healthy adults is pretty much inconclusive.
Inconclusive, so not positive.
Largely, no. There was a systematic review and meta-analysis looking specifically at memory enhancement, and it found no significant clinical difference between piracetam and a placebo. Even in adults who already had memory impairment, the memory boost wasn't clearly better than placebo in that analysis.
Wow, okay, that's huge. So the benefits are really concentrated in those with existing impairment, not in boosting already healthy brains.
That's what the bulk of the rigorous evidence suggests. That key distinction gets lost so often in online chatter. The benefits consistently seem to be about restoring or improving function when it's below baseline, not pushing a healthy baseline higher.
That really clarifies things. So aside from general age-related decline, are there other specific situations where piracetam has shown clear, documented benefits?
Yes, a couple stand out. We talked about age-related cognitive decline, though many trials were short. But a really specific one is after coronary artery bypass graft surgery, CABG.
Heart bypass surgery. How does piracetam help there?
Well, cognitive function often takes a hit after that major surgery. It's a known issue. Acute administration of piracetam, given around the time of the surgery, seems to lessen that cognitive decline.
Interesting. What kind of doses are we talking about?
Pretty hefty ones, like a 12-gram IV injection as a single dose, or 12 grams IV daily starting before surgery and continuing for about a week after, then followed by oral doses for weeks. That suggests a serious therapeutic intent, not just casual use.
Definitely. A very specific medical application. What about stroke recovery? Does it help there?
It shows promise in animal studies, helping reduce damage, but in humans, the evidence is pretty minimal.
So, not clear-cut?
Not really. There was one study on stroke patients with aphasia, that's language impairment. Yeah. They got 4.8 grams daily for 6 months. They saw significant improvement in understanding spoken language, auditory comprehension. But importantly, it didn't seem to help with other language aspects like speaking spontaneously or reading.
So a very targeted effect, maybe, not a general fix.
Seems that way, based on that study.
Okay. What about its use in children? Any specific benefits there?
Yes, this is actually one of the most clear-cut and well-documented areas for Piracetam. It's used to treat breath-holding spells, or BHS, in young children.
Breath-holding spells? What are those?
They're these quite frightening episodes, usually in kids between like 6 months and maybe 2 years old, where they involuntarily hold their breath after being upset or startled, sometimes even passing out briefly.
Oh, wow. That sounds scary for parents.
Absolutely. And Piracetam appears to be highly effective and also safe for treating these spells. Studies show it significantly reduces how often the spells happen, like 70–80% reduction over 4 months.
And the doses are safe for kids?
Yes, the doses used, typically based on body weight, like 40 to 100 milligrams per kilogram per day, haven't been associated with noticeable side effects in these pediatric studies. It seems to be a genuinely beneficial and safe application in this specific group.
That's great to hear. A clear positive finding. Now, you mentioned Piracetam has been studied for a lot of other things too, right? What about those?
Yeah, the list is long. Epilepsy, it has shown some long-term efficacy and safety there, usually added to other meds. Dizziness, dyslexia, maybe some minor effects on reading tests, a movement disorder called tardive dyskinesia.
Okay.
And then things like Alzheimer's, autism, depression, general memory improvement in healthy people, schizophrenia, even sickle cell disease. It's been looked at for all sorts.
But what's the verdict on those?
Well, for many of these, the sources basically say there's no good scientific evidence to support the claims.
Meaning?
It could mean not enough good studies have been done, or the studies that exist showed weak, inconsistent, or negative results. So lots of investigation, but not much solid proof of benefit for many of those conditions.
So again, it circles back to specific, often impairment-related conditions where the evidence is strongest and much less support for broader applications. Let's switch to Aniracetam now. What's the story there?
Aniracetam. It's often flagged as a promising option, especially for folks with what's called mild cognitive deficit.
Mild cognitive deficit. So not full dementia, but noticeable issues.
Exactly. People having memory or thinking problems, but still generally managing daily life. Studies often look at people with MMSE scores. That's the mini mental state exam between 15 and 25. A lower score indicates more impairment.
Okay, so a specific level of impairment. What did the studies find?
Clinical findings suggest Aniracetam helped preserve neuropsychological function for at least a year in these patients.
So it slowed the decline?
Seems like it. And interestingly, it also showed a significant improvement in emotional state measured by a depression scale at the 3-month mark. Though some analyses question if that mood benefit holds up longer term, like at 6 or 12 months.
Potential mood effects, too. How does it stack up against standard dementia drugs like cholinesterase inhibitors?
That's a really interesting comparison. In one analysis looking at patients with relatively mild dementia, Aniracetam actually showed significantly better cognitive performance at 6 months compared to those standard drugs, the CEIs, and better functionality at 3 months.
Better than standard treatment.
In that specific comparison, yes. And even more intriguing, when they compared Aniracetam taken alone versus Aniracetam combined with the CEI, the Aniracetam alone showed superior cognitive performance at 6 months, a trend towards better mood at 12 months, and better functionality at 6 months.
Wow. So in some cases, it might be more effective on its own for mild cognitive issues.
It suggests that possibility, which is quite significant. It challenges the idea that combination therapy is always better.
Definitely. Are there other general cognitive benefits seen with aniracetam beyond dementia specifically?
Yes, some research indicates it can improve things like visual recognition, motor performance, and general intellectual function, again, particularly in individuals who already have some cognitive impairment.
You mentioned anxiety earlier.
Right. It's been shown to reduce anxiety in mice. And historically, it was actually prescribed for anxiety in Japan for a while, though it was later pulled from that market due to conflicting study results. So the anxiety link is a bit complex.
Okay, but this brings us back to that critical question we asked about piracetam. Does aniracetam work for everyone? Does it boost cognitive function in healthy individuals?
And the answer seems remarkably consistent. Studies using normal healthy mice given aniracetam found no evidence that it improved their cognitive performance.
No improvement at all.
None observed in things like locomotion, anxiety levels, spatial learning, motor learning, or associative learning in those healthy mice studies.
So just like piracetam, the benefits seem tied to fixing a deficit, not enhancing normal function.
Precisely. This pattern really seems to hold across the Racetams family based on the available evidence. It strongly reinforces the idea that these are more like cognitive restoratives for impaired states rather than universal brain boosters for the healthy. It really challenges that whole smart drug for everyone's narrative.
It certainly does. Now, is there anything specific about the dosage of aniracetam we should know? Does more always mean better?
This is fascinating and really important. Some research points towards what's called an inverse U-dose effect relationship for aniracetam.
Inverse U, meaning?
Think of it like a curve. Too low a dose, not much effect. There's an optimal dose in the middle where it works best. But if you go higher than that optimal dose, the effect actually starts to decrease again or disappear.
So more isn't better. More can actually be worse.
Exactly. For example, one study looked at object recognition in aged rats. A 50 milligram dose worked well, but both a lower dose, 25 milligrams, and a higher dose, 100 milligram dose, did not work.
That's counterintuitive, but crucial. You need the right amount, not just throwing more at the problem.
Precisely. It highlights the need for careful dosing and understanding the pharmacology, not just assuming more is always the answer.
Vital point. Okay, let's move to our third compound, oxiracetam. What are the key insights here?
Oxiracetam shows some promise too. Clinical evidence suggests it has a modest but noticeable effect in helping prevent cognitive decline in people with vascular cognitive impairment.
That's cognitive decline due to blood flow issues in the brain, like from strokes.
Exactly. And interestingly, the benefit seems more pronounced when oxiracetam use is combined with regular exercise.
Oh, suggesting a synergy between the drug and lifestyle.
It hints at that, yes. It also shows potential for reversing cognitive deficits in Alzheimer's disease. Some studies even suggest it might offer more benefits than standard Alzheimer's meds like donepezil or tacrine.
Again, potential benefits in impaired populations, particularly serious conditions. What about its safety profile? How does it compare?
This is one area where oxiracetam often gets highlighted. Several studies suggest it's generally safe and well tolerated, even when people take relatively high doses for a long time.
So potentially a better safety profile than some others.
It seems that way based on current research, which is definitely a point in its favor. It's also noted as being a very mild stimulant.
Mild stimulant, so it might have slight alerting effects.
Possibly, yeah. It could contribute to feelings of improved focus or alertness, but it's generally considered much milder than traditional stimulants like caffeine or amphetamines.
Okay, so across piracetam, aniracetam, and oxiracetam, we're seeing this really consistent theme. Potential benefits mainly for those already experiencing cognitive impairment or decline, right? Not so much for the healthy brain boost everyone seems to be searching for.
That's the clear pattern emerging from the clinical research, absolutely.
So let's solidify that. Who are the populations that seem to benefit the most from these racetams, based on the science?
If you synthesize all the research, the main beneficiaries appear to be individuals already facing cognitive challenges. This covers a pretty wide range. Older adults dealing with age-related cognitive decline.
Right.
Patients who've been diagnosed with mild cognitive deficit or various forms of dementia.
Okay.
And even in lab settings, subjects who have experimentally induced learning deficits. The common thread is some kind of existing impairment. They act more like restoratives in these cases.
So just to hammer this home, the idea of a healthy student or professional taking these for a general cognitive edge, the evidence isn't really there.
The robust, consistent scientific evidence does not support that use case for enhancing cognition in healthy individuals who are already functioning normally. It's a critical distinction to make, especially given the online narratives.
A huge disconnect between the hype and the data.
A significant one, yes.
Are there any very specific niches where one Racetam clearly stands out for a particular group?
Well, as we discussed, Piracetam really does seem to have a unique and well-documented role in treating breath-holding spells in children. That's a very specific, evidence-based application where it shows clear efficacy and safety.
Got it. Okay, let's talk about the downsides now, side effects. Are there common ones we see across the board with most Racetams?
Yes, there are definitely recurring themes. Headaches are probably the most frequently reported side effect. Lots of users mention them.
Any idea why?
The common theory, as we touched on, is that it might be due to increased demand on the brain's cholinergic system, the acetylcholine system, like the brain is working harder and maybe running low on the resources for that neurotransmitter.
Which leads to the idea of taking choline with it, maybe.
Exactly. That's the rationale often given for co-supplementation, which we'll circle back to.
Okay. What else besides headaches?
Gastrointestinal issues are also pretty common. Things like diarrhea, stomach pain, nausea, general upset stomach.
Not pleasant. Anything else frequently reported?
Mild anxiety can pop up. Sometimes insomnia or trouble sleeping. Irritability and dizziness are also mentioned fairly often across different Racetams.
Okay, so a cluster of relatively common, sometimes mild side effects. But are there more specific concerns or different side effect profiles for each one? Let's start with Aniracetam. I thought it was meant to be well tolerated.
It often gets that reputation, yeah. Some sources call it well tolerated with few side effects, but when you dig deeper, the list can be longer. Potential adverse effects include things like jitteriness, mood swings, increased heart rate or blood pressure, weight loss. Even issues like incontinence or sexual dysfunction have been reported in some contexts.
That's quite a bit more than few.
It is. And while data on long-term toxicity in humans is limited, very high doses might lead to severe insomnia or significant mood changes. So, well tolerated needs context.
Definitely. What about Piracetam's specific list, beyond the common ones?
Piracetam's list includes things like hyperactivity, muscle spasms called hyperkinesia, drowsiness or somnolence, but also sleeplessness or insomnia.
Both drowsiness and sleeplessness. Interesting.
Yeah, effects can vary. Also nervousness, depression, weakness or lack of energy called asthenia, and sometimes skin rashes.
Okay, so its own distinct profile too. And Oxiracetam, we heard its safety profile was maybe a bit better.
That's the general finding, yes. As we mentioned, studies tend to suggest it's relatively safe, even with high doses over longer periods compared to some others. Still, caution is always needed.
Absolutely. Now, what about general warnings or contraindications that apply to pretty much all Racetams? Who should be particularly careful?
Okay, critically important points here. Anyone with a known severe allergic reaction should obviously avoid them. That's standard. Pregnancy and breastfeeding are big areas of caution. There just isn't enough good human safety data. And animal studies have raised red flags about potential reproductive toxicity or harm to the fetus. That's a serious concern.
Definitely warrants extreme caution there. Who else?
Older adults should be cautious, generally speaking. They often process medications differently and can be more sensitive to side effects.
Makes sense.
And a huge overarching concern is the lack of knowledge about the long-term effects of using many of these Racetams, especially consistently over years. We just don't have comprehensive data on that for humans.
A significant unknown. What about interactions with other medications? People often take multiple things.
Yes, and despite claims you might see online about no interactions, the reality is Racetams may interact with other drugs, especially those affecting similar brain chemicals.
Like what kinds of drugs?
Think about ADHD medications like Ritalin, antihistamines like Benadryl, which can affect acetylcholine, some mental health meds like SSRIs, certain meds for overactive bladder, even some blood pressure medications. The potential for interaction exists.
So talking to a doctor if you're on any other medication seems essential.
Absolutely essential. Self-prescribing without considering interactions is risky.
Given all this variation in effects and side effects, is there one best Racetam that stands out as having the fewest issues?
Honestly, no. There isn't a single best one that applies universally.
Why not?
Because the choice really depends on the specific reasons someone might consider taking it, usually a specific cognitive impairment, and their individual factors, their health, other meds, how they personally react.
So it's not about picking the mildest one off a shelf.
Not really. The focus should probably be on which one has the best evidence for the specific condition being targeted in impaired populations, rather than just comparing minor differences in common side effects like headaches. It's about targeted efficacy first, then managing side effects.
That's a much more clinical and realistic way to look at it. Tailored, not general. Okay, let's shift to practicalities then. Dosage, protocols, and that co-supplementation idea.
Right. Starting with Aniracetam dosage, the typical daily range is usually somewhere between 600 milligrams and 1,500 milligrams.
And how is that usually taken?
It's almost always divided into 2 or 3 smaller doses throughout the day. The advice is generally to start low, see how you tolerate it, and then gradually increase if needed, paying attention to effects.
Okay. Any tips for taking it?
Yes, Aniracetam is fat-soluble. That means it absorbs much better if you take it with a meal that contains some fat.
Ah, good tip. Like with breakfast or dinner, maybe.
Exactly. And its effects usually kick in within maybe 30 to 60 minutes, but they only last around 4 to 6 hours. That's why multiple daily doses are often needed for continuous effect.
Makes sense. What about Piracetam? The doses seemed all over the place earlier.
They really do vary hugely depending on the use case. Remember the CIBG surgery? That was 12 grams intravenously.
Yeah, massive dose.
For seizure disorders, it could be anywhere from roughly 10 to 24 grams daily, sometimes for months. Tardive dyskinesia, maybe 8 24 grams IV, or around 5 grams orally per day. Vertigo, lower doses, maybe 800 milligrams 3 times a day.
And for the kids with breath-holding spells?
That was dosed by body weight, 100 milligrams per kilogram daily. So it completely depends on the condition being treated. There's no single Piracetam dose.
It really highlights how these are studied for specific medical contexts, not general use. So is there any kind of overall preferred protocol for taking Racetams in general?
Given everything we've said, the different compounds, the varied evidence for specific conditions, the wildly different legal statuses, no, there isn't a single universally recommended protocol. It has to be substance-specific, context-specific, and ideally guided by research or a professional.
Reinforces the need for caution and guidance. Okay, now let's properly tackle co-supplementation.
Yeah.
You mentioned choline earlier, especially with Piracetam potentially helping with headaches or boosting effects.
Yes, this is where it gets really interesting from a synergistic perspective. There's research, notably a study in aged rats, that found profound effects when combining choline with Piracetam.
Profound how?
It led to significantly enhanced memory performance and improved cholinergic function in those older rats compared to either substance alone.
So 1 + 1 = 3, potentially.
Potentially, yes, at least in that model. The idea is if Piracetam increases the brain's use of acetylcholine, providing extra choline, the raw material, might help sustain that activity, maybe reduce depletion that could cause headaches, and possibly enhance the cognitive effects.
So taking a choline source alongside Piracetam might be a sensible strategy for some.
It's a plausible hypothesis based on that mechanism in research, especially for targeting memory functions linked to the cholinergic system. Yep. It suggests a more nuanced approach than just taking the Racetams in isolation.
Very interesting. It shows how complex brain chemistry is. This naturally leads us into the final major area, the really complicated regulatory landscape and the risks people take with self-administration.
Yeah, this is a minefield, honestly. The legality is incredibly complex and just all over the map depending on where you are in the world.
Creates a lot of confusion.
And potential danger. The way these are regulated or not regulated varies hugely.
Give us some examples. What's the deal in the U.S.?
Okay, in the United States, Racetams like Piracetam, Oxiracetam, Aniracetam, and others, often discussed as nootropics, even things like phenylpiracetam, pimericetam, Nupect, adrephenil, phenibut, they are not approved by the FDA for any medical use, period.
Not approved at all?
No. The FDA classifies them as new unapproved drugs. This means they cannot be legally sold or marketed as dietary supplements.
Because they're seen as drugs needing approval first.
Exactly. But here's the legal gray area. They are not typically classified as controlled substances like narcotics are.
So owning them isn't necessarily illegal.
Generally, possession for personal use isn't explicitly outlawed at the federal level, though state laws could vary. But marketing them for human consumption is illegal if they lack FDA approval.
Which leads
to them often being sold online, labeled as research chemicals or not for human consumption, as a way to try and skirt the regulations.
A very tricky situation. How does that compare elsewhere? Europe? Australia?
It's completely different. In some European countries, certain Racetams are prescribed by doctors as actual medication.
Prescribed, okay.
But then you look at Australia, very strict. Piracetam is Schedule 4th, meaning prescription-only medicine. All racetams fall under that schedule there. And Aniracetam, Oxiracetam, pyrrolidone aren't approved at all.
Wow, huge difference. What about the UK or Canada?
Again, different nuances. In the UK, natural nootropics might be okay over the counter, but synthetic ones, like many racetams, could fall under their Psychoactive Substances Act, making them controlled if unlicensed. In Canada, they're often unscheduled, so not illegal to possess, but if deemed a drug, they need a prescription, and importing them might get stopped at the border.
It really is a global patchwork quilt of rules.
Totally. India. Piracetam might be over the counter. Germany, Japan, Russia, Brazil, China, they all have their own specific, often complex rules.
So the absolute bottom line for anyone listening is,
you must check the specific legal status of the specific substance in your specific country and maybe even region before you even think about buying or using it. Ignorance isn't a defense.
Wise words. This complexity ties into that whole dietary supplement versus drug debate, doesn't it? How are these usually classified?
Often, especially in the U.S. market for things sold quasi-legally, they fall into the dietary supplement category by default, which gets much lighter regulation than drugs.
And the implication of that is?
Supplements are generally assumed safe until proven harmful. The burden of proof is on the regulators after it's on the market. Drugs have to prove safety and efficacy before they hit the market. It's a massive difference in consumer protection.
A huge difference. Reminds me of Dr. Gigio, the father of nootropics. What was his original idea?
His vision, back in the 60s, was quite idealistic. He wanted to create cognitive enhancers that lacked the typical side effects of psychotropic drugs. Basically, improve the brain without the downsides.
A perfectly safe brain booster.
That was the ideal. If that were perfectly achieved, maybe strict regulation wouldn't be needed. But reality is complex, and you see the result in online forums, Reddit, Blue Light, huge communities discussing DIY nootropics, stacking, sourcing, safety, people navigating this gray area themselves.
Trying to achieve that ideal, perhaps, but without the safety net. So what are the real tangible risks when people bypass regulations and source this stuff online, self-medicating?
The risks are significant. First, accessibility doesn't equal safety. Because they're not usually in regular pharmacies, people buy from niche websites, often international, selling research chemicals.
And the problem there is?
Quality control. Or rather, the lack of it. You have no real way to know if what's in the bottle is actually what the label says, or if it's pure or the right dose. Is it contaminated? Is it a completely different substance?
Those third-party lab tests advertised online.
Often impossible to verify independently. It could be fabricated or testing only one batch. You're basically trusting an unregulated seller, potentially overseas. It's a gamble.
A potentially dangerous gamble. And there are legal risks too, even if you just buy for yourself.
Absolutely. Importing these substances, even just for personal use, could violate your country's laws. It could lead to seizure by customs, fines, or even more serious legal trouble, depending on the substance and location.
So beyond purity and legality, what's the bigger picture risk?
The bigger picture is self-medicating with potent psychoactive compounds where the long-term effects on human health are largely unknown. We just don't have decades of data on widespread use. The FDA issues warning letters to companies making unproven claims for a reason. There's a big gap between availability in these gray markets and actual scientific validation and safety approval.
Okay, let's try and wrap this up, pull together the main threads from this deep dive. What we've really seen exploring Piracetam, Aniracetam, and Oxiracetam is, well, it's complicated, isn't it?
Definitely not simple.
The science, the clinical trials, they strongly point towards the most consistent benefits being for people already experiencing some kind of cognitive impairment or decline.
Yes, that's the clearest signal. The idea of them being a general cognitive enhancer for healthy folks just doesn't hold up well under scientific scrutiny.
And while they might be generally well tolerated for many, they absolutely come with potential side effects, from common things like headaches.
Two more concerning possibilities hinted at in some studies, especially regarding long-term use or vulnerable populations like during pregnancy. The full safety picture isn't complete.
And the legal situation is just a mess globally. A patchwork of confusing regulations. What's a prescription drug here might be totally unregulated or illegal somewhere else.
Making careful checking absolutely vital.
It all really underscores that despite the hype you see online, the enthusiastic anecdotes, solid scientific validation is what truly matters. It's not about what something might do, but what it actually does reliably and what the known risks are. So thinking about you, the listener, navigating all this information, what does it really mean to try and enhance a healthy brain, especially given the often inconclusive research in healthy people and all these regulatory and safety warnings?
It's a deep question. At what point does that drive for peak performance or just curiosity cross into territory where the unknowns, the potential risks, start to outweigh the proven science? How do we balance that desire for optimization with being safe and evidence-based?
It's a crucial balance to strike, and it really brings us back to basics. Before considering any kind of nootropic regimen, especially with underlying health conditions or other medications, please talk to a licensed healthcare provider. Get personalized, informed advice.
Absolutely. And don't forget the basics. Things like regular exercise, a healthy diet, good sleep, managing stress. These are still the most powerful, safest, and most evidence-backed tools we have for maintaining and improving cognitive function.
Your foundational smart drugs, really. Thanks for joining us on this deep dive.